All right, so that was the Prime Minister there in his second address to the nation, and this time it was an even more serious announcement that the Prime Minister made. Round one, it was a Janta curfew for just one day, but now the Prime Minister announcing that there will be a lockdown, a nationwide lockdown from midnight tonight, which he said will last for 3 weeks. 21 days, he said, is the duration that this lockdown will last, and he said it's absolutely essential to ensure that the coronavirus does not spread. And he essentially said that this is the only way Indians can protect themselves, that if they treat their homes as if there is a Lakshman Rekha outside the door, and that virtually nobody should step out for the course of these 21 days. So a big announcement there coming from the Prime Minister. In a sense, the Janta curfew was like a trailer for the real deal, which he's announced tonight on national television. Now remember that there are still some details that need to be worked out in terms of how supplies and food and essentials are going to function. He did make a reference to them, that there will be an attempt to ensure that supplies carry on as earlier, but those are details that we still need to hear a little more from the government about. But for the moment, the Prime Minister making that big announcement that, in a sense, the build-up of all the lockdowns that we've seen being announced by different states now will turn into virtually like a national curfew. The Prime Minister saying that this really is the only way to stop the spread of the disease, that social distancing is the only thing that seems to be working around the world. So that's a big, big announcement now, perhaps the most strongest lockdown announced possibly by any country which is still so early into the stages of this disease. He also said that they're very concerned about the impact that this is having on the poor, and that they will take steps to monitor that, and that he's also asked state governments to ensure that they focus entirely on health services. He said the priority for state governments should be that they focus very much on providing health and health services. He also said that the government is going to make sure that they step up the amount of equipment, health equipment, what is called PPE. This is personal protective equipment, which is used by medical professionals to tackle the disease, that he'll make sure that good supplies of those are procured by the government. But the big announcement really is the fact that what started off as a dry run, the Janta curfew on Sunday, has now turned into a full-scale lockdown starting from midnight tonight across the country. He did at the same time praise health workers, police, media and so on for doing their job, which gives us an idea that perhaps these categories of people will obviously have to be exempt during this time of the severe lockdown. But again, those are details that we are still waiting on. So this is now, in a sense, giving us the blueprint of how India is going to approach the coronavirus and how India is going to fight back against the coronavirus. Okay, let's just start seeing if we can get some reactions to the big announcement from the Prime Minister. I believe Dr. Arvind Panagaria is with us. Former VC Niti Aayog, of course, at the moment joining us from New York. Thank you very much indeed, Dr. Panagaria, for joining us. You also, perhaps like us, were just listening very closely to the Prime Minister. What do you make of what he's just announced?
Srinivasan, I think it's a very, very powerful speech. The imagery and the language that he used was incredibly powerful. When he turned to people saying, "Haath jod kar aapse prarthna karta hoon ki aap andar rahein." He said, if we don't do this, we'll be set back by 21 years.
Yes.
These 21 days are crucial. He said, "Jaan hai to jahan hai." I think, this is a very, very powerful message, the kind of message that the nation needs to hear at this hour. I completely endorse his action. In fact, if I had been in Delhi today, this is exactly what I would have pitched for on my own.
Right.
Because, the nation had the kinds of resources, for example, South Korea had, and the kind of population that South Korea had to deal with.
Yes.
There are only 50 million people, and per capita income $25,000-$30,000.
Yeah.
They have a lot more resources. We don't. And I think for us, this is really the only hope. And I must say that so far, we are lucky that the number of cases in India are still, what one would characterize as stage 2 of this crisis.
Yes.
And so therefore, early action of this kind can indeed break the cycle. See, New York, for example, where I am sitting today,
Yes.
reacted a little late. Personally, I went out into lockdown myself on something like 8th March,
Right.
where when the cases within the New York City were only 12.
Right.
Today we are dealing with 13,500 cases.
Sure.
We are adding 2,500 cases every day.
Actually, you're right. I mean, America, in a sense, is emerging as currently the #1 coronavirus hotspot in the world, tragically.
Indeed. And within America, New York City, where I am sitting, really is the
hotspot.
hottest spot. Yeah.
Right.
So I think this is very much called for.
Right.
And I really am glad that
the Prime Minister did this. Okay. Let me just come back to you very shortly. Let me just go across to Dr. Pratap C. Reddy, Chairman of the Apollo Group of Hospitals. Thank you, Dr. Reddy, for joining us. Your first comments, I'm sure you were also sitting and listening to the Prime Minister. Do you also believe that a step this severe was necessary at this stage to check the spread of the virus in India?
Thank you, Srinivas. I heard the Prime Minister. I don't in all my life, either in medical or in other society, I've never heard any Prime Minister or individual who could convey a heartfelt advice for people of the country. There are 3 very, very important things that he said. This virus is one which will automatically transmit to several hundreds and hundreds of people. So the first and most safest thing that you should do is the safe distancing.
Right.
He stressed on that point very, very clearly.
Right.
Then he said the number of steps that the state and the central government is taking.
Yes.
But really, and he also appreciated saying even the most affluent countries like US, which have got all the best, so-called best healthcare facilities, is still facing a huge crisis. And I just heard the doctor from New York saying what they are going through at this time.
Yeah, that's actually Arvind
the lesson is very clear
he's an
because
economist.
he has taken
yes,
the first
yes.
step on Sunday.
Yes.
That was a great thing, stay at home. The third one is that 5 minutes, everybody when they clapped, it was in their heart saying,
Yes.
I'm thanking God. I'm thanking God for giving people who can rescue us. I think that made a very big impact. Number of people have mentioned this. It is not just healthcare alone.
Yes.
It is the entire service sector which is involved in stopping this huge, transmission of this COVID virus,
Yeah.
which is causing very, very, very
But
severe
I just
conditions
want to
across.
ask you on that,
This is the
Dr.
most
Reddy.
critical situation
Dr.
that
Reddy.
any country, any time has gone through.
Right, Dr. Reddy, I do want to ask you this though, because
Yes,
the Prime Minister didn't directly, in the last speech at the time of which he made for announcing the Janta curfew, he did make it clear that certain categories of people will obviously be exempt, like healthcare professionals, obviously security forces, media and so on, and also that essential services will be open. People can access food and so on. He didn't do that this time. So there is a bit of a concern about that, because already what's happening is that with the lockdowns being announced by state after state, people are finding it, even people who have good reason to move around are finding it hard to get in and out. Even doctors, medical professionals, as I'm sure you know, perhaps your own staff, are struggling to move around. So is it important to also get clarity on that?
I think it's very clear when he said lockdown. Lockdown does not include, when he thanked the healthcare services
Right.
All other people who are contributing to the services to stop this, the massive critical healthcare situation
Right.
as of today, I think it's very clear. He clearly said healthcare people, starting from a doctor to the ward boy, are equally important. I had a lot of discussion with all of when we made these plans, and for the people in general, the word he used, Lakshman Rekha, is the wonderful thing. The Lakshman Rekha is for people to stay at home, not get infected and pass on that infection for tens and hundreds of people. So I think two messages were very clear.
Right.
Number one, for people to stay at home.
Yes.
And then number two is the healthcare people, what can you do? Just because we don't have the so-called affordable American healthcare facilities.
Yeah.
No, there I believe I can say if the people that are now in the healthcare services
Yes.
are all willing to give their very best
Yeah.
for their own kith and kin, for the country and world
No, that's
at large.
very important.
So
In
I
fact,
have no doubt
that's
that
very important.
The entire
That's-
healthcare force.
That's very important. In fact, my colleague Sunil Prabhu reporting that there is going to be a detailed notification by the Home Ministry shortly. And Sunil Prabhu, in fact, is on the phone line with us, Sunil. So I think from what I understand from your message that the details about exactly who will be exempt and how there will be access to food and supplies, you're saying that's expected in an order shortly.
The Ministry of Home Affairs, Srinivasan, will issue an order in the less than an hour's time. I have spoken to top Prime Minister's officials who have now indicated that there will be a lot of restrictions. Essential services will be provided. As Dr. Pratap Reddy was pointing out, doctors and the medical fraternity will be exempted. The media will be exempted, but there will be a lot of restrictions and safeguards that will be made so as to ensure that this 21 days lockdown can be complied with. So it's in effect a massive lockdown, but definitely the government understands that 1.3 billion people staying in their house is not an easy task.
Right.
Certain measures need to be taken. Certain people, essential services need to continue with their work. So we will definitely see a revised order in a few minutes from now, hopefully before you finish your bulletin.
Right. I think that's very important because people are watching and they're trying to process what he said, and it's important to get that clarification on what is allowed and what is not allowed. That'll help calm down people, because I think the immediate thing that you want to know is how will you be able to access your daily needs, and how will you be able to go out and get your food, your medicines and so on, when he's made it so clear that you can't literally step out of your door. So hopefully those clarifications will come. But I do want to ask you, Dr. Panagaria, about what he said about the impact on the poor, because while lockdowns are crucial, we know that for the poor, that the lockdown and the coronavirus as a whole is turning out to be like an economic tsunami. Livelihoods are being upturned by the thousands, and many of them are rushing back to their villages where there aren't too many better prospects. The Prime Minister has said that this is something he's looking at, that the government is aware of. He said that on Sunday as well, that there's going to be a task force, but we haven't heard anything concrete yet. Isn't it crucial that we get some clarity on how exactly, what are the safety nets that will help protect the poor for the next 3 weeks, because they'll have literally no access to any source of income?
Absolutely, Srinivasan. But I think Prime Minister was right actually to focus on the central message in the address to the nation. I think he needed to really convey the message of the urgency, the importance, the virtual emergency that we face today. And so I personally think that his speech was exactly the right. And you are also right that people need to know what are the flexibilities, how are they going to get through these 21 days. And so therefore, follow-up messages, follow-up press releases, etc., should come pretty soon. For the poor, indeed, and I'm certain that there are plans. This is being discussed in the background. How to get, for example, food supplies to the poor, even to those who are staying at home and have the means financially ultimately food supplies have to be available.
Yes.
So these are things, we are also like in New York, we are working through these things. We find out who online is supplying us. Sometimes there is a wait of 5 days, sometimes a wait of 7 days.
Sure.
So we try to, look for various different means. So it's going to be people working in cooperation with the government. So I think I would not panic. These are, and this is a war-like emergency. And therefore, we have seen that before. I sort of remember my days from the China war to the Pakistan war of 65, then 71. So we all know that, these are hardships, but I think to keep the country together, to keep the lives of the people, for the future of the country, this is something that needs to be done. And the people have to rise up. I think, people have to cooperate, because in this case, 95% cooperation is not good enough. It has to be 100%, because the virus sort of, even if 1% deviate, and some of those 1% happen to be infected themselves, then they can really multiply the numbers in no time, as we have seen here in New York City.
Right, because that's the concern, that because there is still a gap of, it's about 8:45 p.m. here in India, that in this gap between now and midnight, there's going to be a lot of people rushing out, and a lot of people are going to be doing panic buying because they're worried about how it's going to work, once the curfew kicks in, once the midnight curfew kicks in. So I wish there'd been a little more clarity about that. Also, some breaking news coming in from my colleague Sunil Prabhu, that the National Disaster Management Act has been invoked, and I suppose it's perhaps under that these further stringent regulations are going to be imposed. The Principal Secretary and the Cabinet Secretary will be speaking to the Chief Secretaries of all the states to essentially, I suppose, convey to them how exactly this is meant to be rolled out. So all of this is, of course, happening as we speak, imminent, as in the sort of moments after the Prime Minister's speech. So let me just also get a view from across the political aisle. P. Chidambaram, a senior Congress leader, former finance minister, on the phone line. Mr. Chidambaram, your first thoughts on the Prime Minister's latest announcement?
Well, it's a mix of emotions. I'm happy, relieved, frustrated, disappointed, and feeling a sense of helplessness. It's a mix of emotions for various aspects of the Prime Minister's speech.
Okay. Would you like to take us through to understand each of those statements you made? You said you felt happy, but you also felt frustrated.
I'm happy and relieved that finally,
yes,
the government has heeded the advice of epidemiologists and medical experts like Dr. Devi Shetty, that a complete lockdown is the only answer to coronavirus spread. This should have come several days earlier. I'm frustrated because in the meanwhile, people have traveled. Thousands have left their places in Mumbai and in Delhi and in Hyderabad and gone back to the villages. I don't know what they are carrying. I sincerely hope they're not carrying anything in terms of the virus.
Okay, so that is
I'm disappointed because having announced a 21-day lockdown, simultaneously the government should have announced a substantial package of relief to the poor. What will the guy do tomorrow, day after? All right, he may survive for 2 or 3 days, but what will he do after 3 days? He should have announced a substantial package. We've been tweeting about it, writing about it for the last week or 10 days. The ideas are there on the table. Just pick up any idea and implement it in whatever manner you like.
Right.
And I feel helpless because while the Prime Minister's intentions are certainly good, it may be that he has allowed things to go a little out of hand that the cost will be far more today than what it would have been if this lockdown had been announced a week or 8 days ago. He has to quickly come up with an answer to how we're going to protect the poor.
Right.
The daily worker, the self-employed, the agricultural laborer.
The finance minister, if I may just jump in for a second, the finance minister who had a press conference today, she did say that this economic package is very much being worked on and it will be announced shortly.
What is there to work on? The Prime Minister announced the task force on the 20th, which is, I think, a Friday.
Right,
And he said a task force will be constituted.
right.
And this morning, the Hindu reports that the Ministry of Finance officials have said they know nothing about the task force, and they are not their responsibility to constitute the task force.
Mm-hmm.
Then why does it take 4 days to constitute a task force?
Okay.
And why does it take anything more than 4 hours to arrive at an immediate package?
Okay.
It's just beyond my comprehension. Let
Okay,
the finance
yeah.
minister sit down,
Yes.
and I will name 6 people, not including persons like me, who will go and meet her,
Right.
and the 6 people will give her each 2 suggestions.
Right.
She can pick any 6 of those suggestions and implement them within an hour thereafter.
Okay.
What are we working on? I can't understand.
Okay. Just a last question from you, because you've also been Home Minister. Given the size and complexity of a country like India, realistically, will it be possible to enforce a curfew or a lockdown which is so severe for such an extended period of time?
It is going to be very, very difficult even under normal circumstances. We've got 650,000 villages, and then the towns. In our towns and cities, you know how the housing is.
Right.
The density of population in our towns and cities is so high, housing is so cramped, that sometimes social distancing doesn't make any sense because you're cheek by jowl with other families or
Right.
other members of your own family. Be that as it may, all that cannot be changed.
Sure.
You can't blame the government for that. That's
Of course.
a fact.
Yes.
What I understand by lockdown in the villages is you have to stay put in your village.
Right.
You have to stay put in your street,
Right.
or you have to stay put in your neighborhood, which is possible in a village.
Yes.
There may be about 6 or 7 streets in a village, and
Right.
there may be about 25, 30 houses in a street, and you stay put there. I know my party workers in some villages have called me to say that their villages have already organized themselves to ensure that nobody from outside enters the village,
Right.
and nobody from the village ventures outside.
Right.
So that's all that you can do in a village. I don't know what the behavior is in villages of Bihar and Madhya Pradesh and Uttar Pradesh and Haryana.
Right.
But somebody brought to my notice today that the harvesting season will start on April 1.
Okay.
The crops are ready to be harvested. You need people who can work the combined harvester. You need labor, which comes from Bihar, UP, and Madhya Pradesh. Now, government must have a plan for all that.
Okay. So I think. Okay, we're out of time. So I think there is still much that still has to be worked out, and
Serious problems, but the
hopefully-
government must work
Yes.
round the clock and address those problems every hour and come up with meaningful solutions within the next 24 hours.
Okay. Well, let's hope that those details do come. But thank you very much indeed, Mr. Chidambaram, for joining us. Thank you all. In fact, Dr. Panakarya, all of you for joining our show. That's all the time we have. We'll take a short break, but don't go away. We'll have Vishnu up in just a second to look even more closely at the Prime Minister's big announcement.